Good morning, distinguished guests, my teachers, and esteemed colleagues. It's an honor to be here before you today, and I'm very excited to share our work on knowledge, attitude, and practice on corneal donation and transplantation among the allied ophthalmic personnel in the community eye centers in Nepal. Before we begin, I'd like to disclose our study was funded by HCP Cure Blindness. We have no other conflict of interest and no other financial interests. So I'll start out today by briefly talking about the impact of corneal blindness. According to the IEP Vision Atlas, the corneal opacity accounts for 3.46% of global blindness. From 2008 to 2010, a series of RAB studies was conducted in Nepal for individuals over the age of 50. And according to the study, despite massive expansion of eye care services over the last 30 years, the prevalence of corneal scarring had actually doubled. So the advent of corneal transplantation in Nepal began in 1967, but a substantial increase in transplantation rates occurred only after the establishment of Nepal Eye Bank at Tilganga Institute of Ophthalmology in 1994. Initially, they faced significant struggle to obtain corneas by just voluntary donations. So Nepal Eye Bank initiated a motivated corneal donation program, which then led to a significant increase in corneal donation rates. So although similar to eye banking model in many other countries, motivated donation in Nepal is conducted not only via a hospital corneal retrieval program, but also via a unique retrieval center where a holy religious site, Pashupatinath Temple, is used for cornea collection as people bring their loved ones for cremation in the crematorium at the temple. So this picture shows the corneal excision center at Pashupatinath Temple, where the corneas are extracted. So now I'll talk a bit about the eye healthcare delivery system of Nepal. So the primary eye care services all over Nepal are mostly still provided by non-governmental organizations via community eye centers staffed with ophthalmic assistants or eye health workers, and secondary and tertiary eye level facilities are still mostly concentrated in major cities. So this structure of eye health delivery in Nepal places the allied ophthalmic personnel in a unique position where they can effectively disseminate awareness regarding corneal donation and transplantation. So after having talked a bit about the situation of corneal blindness and Nepal's eye health system, I'd like to jump into our study. So our study aimed to assess the knowledge, attitude, and practice pattern regarding corneal donation and corneal transplantation among allied ophthalmic personnel in the community eye centers under Tilganga. While conducting our literature review, we came across the table on the screen. Where you can see the rate of eye donation per million population among different countries, and Nepal has a relatively low eye donation rate. This was a big motivator for us to conduct this research, and we are hoping to contribute to our understanding of why the donation rates are low. So our study was a questionnaire-based cross-sectional study among the allied ophthalmic personnel working in 19 community eye centers of TIO. There were 44 respondents. The questionnaire was it was a pre-tested questionnaire designed by a team of fellowship-trained cornea experts, and the questionnaire contained 33 questions evaluating knowledge, attitude, and practice pattern regarding donation and transplantation. So heading on to our results, we've highlighted a few of our study findings that we thought were interesting. So while conducting the research, we were curious about our participants' knowledge of eye banking infrastructure of Nepal. So when inquired about the number of eye banks in Nepal, about 52.5%, only 52.5% correctly stated that there was only one eye bank in Nepal. 38.6% estimated that there are 5 or fewer retrieval centers in Nepal, while nearly 37% claimed they did not know. We were also curious about the participants' awareness regarding the demand and adequacy of corneas in our country. So when inquired about the annual corneal donation and transplantation rates, 38.8% responded that there were more than 1,000 corneal donations every year in the country, and 43.2% responded that there were more than 1,000 transplantation being conducted yearly in our country. So, and when asked if it was adequate, if the demand and supply met, 47% stated that it was adequate, while 34.1% disagreed. They thought the demand was still inadequate. Also, one of our primary goals in this study was to see how corneal donation and transplant proactively counseled any patient about eye donation. 72.7% said they had experience counseling patients regarding eye donation, but majority of them, about 54, only did it infrequently. So 66.7% of those who had never counseled patients regarding eye donation revealed insufficient training and information as the primary reason for not doing so. Similarly, when we asked them about referrals for corneal transplantation, whether they had referred patients to tertiary centers for corneal transplantation, 54.4% claimed that they had. And out of those who had never referred a patient for corneal transplantation to a tertiary center, 60% mentioned lack of information and training as the primary reason of not doing so. Interestingly, about 80% respondents reported that patients themselves had inquired about eye donation. So this study was not without its limitation. Although the respondents were from community eye centers spread across Nepal, they were all community eye centers of Tilganga, a single institution. We think further study encompassing greater number of allied ophthalmic personnel across various institutions would be really helpful. So in this presentation, we've been asked to highlight our struggles and solutions and impact. So I think that's where we're heading now. So we first thought of this research after one of our investigators.
1 minute remaining.
Thank you. After one of our investigators' father asked us some questions regarding corneal donation and transplantation for a documentary he was making. So while trying to answer his queries, we realized that we were not pretty confident regarding the details of the work the Nepal Eye Bank does and the infrastructure of eye banking in Nepal. So this realization turned into curiosity, in which eventually turned into this research project. But as residents, a significant hurdle was securing funding for our research. And as luck would have it, HCP Cure Blindness had just called for project submission for their inaugural resident research grant, for which we luckily got selected. And another challenge was conducting a survey among ophthalmic health workers posted all over the country. For this, we reached out to the outreach clinic of Tilganga and coordinated with them and leveraged a conference that was happening for our participants at Tilganga to complete majority of the survey. For the rest, we asked the help of our IT team at Tilganga to set up online one-to-one surveys. Talking about the implication and impact, we are on the process of submitting our research report to Corneal Transplantation and Eye Banking Journal. We also plan to share our data and research findings with Tilganga Institute of Ophthalmology. One of our investigators and mentors, Dr. Sagar Ruit, is a cornea, cataract, and refractive surgeon and a faculty at Tilganga, and he plans to use the study finding to enhance training programs and curriculum for ophthalmic assistant and optometrist students at Tilganga. Eventually, through a collaborative effort, we hope to increase both voluntary rates and hospital retrieval corneal rates. Finally, I'd like to thank our great team for their determination and hard work. Thank you. And thank you.
I'd like to thank all the speakers for such engaging and wonderful presentations. And we'll now open the floor for some questions from the audience. So.
This is for Syed. There was a bit of a confusion. You said you measure distance as the crow flies. But as we go, if you are going from आप बीच में आओगे तो मेरे को नहीं देख सकते मैं क्या बोल सकता. If you go from here to Banaras, the crow takes 45 minutes. The road takes 9 hours. So I think rather than the distance, whether it's as the crow flies or anything else, it's the actual travel time because road conditions may be very variable. Maybe that is something you could consider. Because I was very worried about as the crow flies. That could be a dangerous thing.
Like in Bangalore, road flies is very easy.
No. This is one of the challenges we had because that's what I was discussing with Dr. Rajiv also yesterday. Like because this lat long is quick and we had this luxury of having a geography